In this program, we will describe the techniques of serving a meal. It is important for the physical and emotional well-being of an individual to make sure they are served the correct meal and to help create a pleasant mealtime experience. We will describe serving a person who is independent in eating and a person who requires assistance. As a nursing assistant, you will sometimes serve meals to individuals who are able to eat independently or with minimal setup assistance. Be sure to perform hand hygiene before serving meals or providing any care. Then introduce yourself and identify the individual by checking his wristband. Give him an opportunity to use the toilet, bedpan, or urinal prior to mealtime. Help the individual wash his face and hands and brush his teeth as necessary before the meal. Before serving the meal, prepare the eating environment. Encourage the individual to eat in the dining room if possible, to encourage socialization and interaction with staff and others. If the individual prefers to eat in his room, remove any unsightly objects and take care of any offensive odors. Create a pleasant environment by adjusting the lighting. Clean off the table where the meal will be served. Position the overbed table at the appropriate height and distance from the person. Then perform hand hygiene again before handling the food trays. Check the diet card for the name of the individual, the diet order, and any special instructions or allergies. If the food on the tray does not match the information on the card, notify your supervisor or return the tray to the dietary department for a correct tray according to your facility's policy. Make sure the tray contains eating utensils, napkins, and condiments. Serve the food as quickly as possible so that the temperature of the food will be desirable. Double-check that you are serving the right tray by matching the name band with the name on the diet card. Uncover the food and provide assistance according to his needs and plan of care. Make sure everything is within the person's reach. Open any packages of food. Help pour the drinks and cut the meat if needed. Ask if he has everything he needs for the meal.
Mr. O'Brien, do you need anything else?
No, thank you. I'm fine.
Okay, great.
Make sure the individual has what he needs and has started eating before you leave the room. Double-check to make sure the call light is within easy reach, in case he has an emergency or needs assistance. Some individuals require the use of assistive devices, such as plate guards and special utensils that enable them to maintain or regain independence in eating. The caregiver should be familiar with the individual's care plan and ensure that the approaches regarding improving independence are followed. Check in with the person periodically to see if more assistance is needed. Encourage him to eat and drink all of the diet that is served. If he is eating poorly or refuses the meal, it is important to offer a substitute according to your facility's policy. Talking pleasantly with him during the meal service promotes a warm and accommodating environment and may result in a better response to the food. Remove the tray when the person has finished eating, and note the amount of food and fluids consumed. Also, note any comments or requests made by the individual concerning the food. After removing the tray and cleaning the overbed table, assist him in washing his hands and help clean up any food particles or spilled food on his clothing as necessary. Position the individual according to his care plan and make sure he is comfortable. Finally, be sure to perform hand hygiene after providing care. If he has refused an item of food, record what type of substitute was offered and whether or not he accepted it. Report any unusual observations to your supervisor. which could also mean emotional or behavioral changes. Now we will discuss the procedures for serving a meal to a person who is not able to eat independently. If the individual is unable to eat independently, it will be necessary for you to feed her the entire meal. Because the totally dependent individual is at high risk for choking, only small amounts of food are given. Never attempt to feed a person who is unable to chew or swallow. As always, be sure to perform hand hygiene before providing care. Identify yourself. Greet the individual and provide assistance for toileting as needed or according to the toileting plan. Before serving the meal, prepare the eating environment. Clean off the table where the meal will be served. Position the individual in a chair if possible and make sure she is comfortable. If she cannot move to a chair, raise the bed to as near a sitting position as is appropriate. Help her wash her face and hands and brush her teeth or provide oral care as necessary before the meal. Position the overbed table at a comfortable work height in front of the person. Then perform hand hygiene again before handling the food trays. Be sure to check the diet card for the name of the individual, the diet order, and any special instructions or allergies. If the food on the tray does not match the information on the card, notify your supervisor. Make certain of the individual's swallowing status and whether thickened liquids are a part of the prescribed regimen. If thickened liquids are a part of the care plan, ensure the liquid provided is the right consistency. Be sure you are serving the right tray by checking the name band to match the name on the diet card. Tell the individual what foods are on the tray. Be aware of her likes and dislikes so that substitute items may be obtained. Talk to her, creating a mood for a pleasant social experience. Seat yourself so that you can make eye contact with the individual. Position the napkin to protect the individual's clothing. Remove the protective coverings from the food. Before feeding the individual, test the temperature of the food by feeling the container. Encourage her to participate and help herself as much as possible. Allow her to choose how the food will be seasoned and in what order it will be served. Use a spoon for feeding. First, give a small amount to test the person's ability to chew and swallow. If she is paralyzed on one side, place the food on the side of the mouth that is not affected. Be sure to cut any meat into small pieces. To avoid choking, only fill the spoon half full. Feed from the tip of the spoon, using gentle downward pressure on the center of the tongue. Alternate between liquid and solid foods throughout the meal. Take your time, allowing the individual to taste, chew, and swallow the food. When the individual is finished eating, use the napkin to wipe around her mouth. Assist the individual in washing and drying her hands, and help her clean up any food particles on her clothing. Follow the individual care plan to determine if repositioning is needed. Make sure she is comfortable. And raise the side rail. Finally, remember to perform hand hygiene after giving care and report any unusual observations to your supervisor. Document the amount of food and fluids consumed. Also, note any comments or requests made concerning the food, substitutes offered, and whether they were accepted. Serving meals provides a time for socializing and observing an individual's overall condition, whether she eats independently or requires assistance. The person can sense whether you're rushed and may respond by not completing the meal. The caregiver plays an important role in ensuring that the meal experience is not only getting food and fluids into the person, but that mealtime is treated as an important time to provide a pleasant and healthy experience.